Hello.
Welcome.
Welcome. We are back and super excited because we're going to be talking about a question I think we get often as far as how visceral manipulation can help with women's health issues.
Yeah,
So,
it's going to be it's a pretty incredible topic to chat about. Today is definitely going to be more of a general overview of how we work with women's health issues. And there'll definitely be more discussions in the future about some of the incredible details and specifics.
yeah, yeah. I think as we were kind of prepping for today, we realized we were reminded how every single organ can affect women's health issues, which is, I think, again, why we love what we do, because it always comes down to the listening. What's the body telling us? You know, someone might have issues with fertility or painful periods, but it could be their lung that we have to work first. So we will dive right in. So we basically, from a general women's health standpoint, we will treat a huge list of things that I'm actually going to read off to you because it is quite large. So these are some of the things we help women with: prolapses, incontinence, different neurological issues, any musculoskeletal pain during pregnancy, or even the painful periods. We've got lack of period, so lack of having a menses, whether it's athletic induced or hormone induced. We can address it that way. We do a lot of fertility, endometriosis, irritable bowel syndrome, and how that just lives so closely to all the pelvic organs, menopause, interstitial cystitis, such a hard word to say.
It is.
Anything with like an abortion or miscarriage. Thank you. So that's kind of, did I miss anything else? PCOS is another really common one. So we're going to dive deep into those. And so starting off with, I think a really cool example is we have a patient who has had a long history of PCOS, so polycystic ovary syndrome. And so she has these cysts that develop, get really big, and they burst, typically around ovulation. And she also has a history of gut issues. And so when we look at specifically the right side, the right ovary has that direct connection to the large intestine.
Yeah, to the cecum.
Yep.
Yeah, so like you're saying, it's pretty wild. Like even people that I think her primary complaint was even the digestive stuff. Didn't the pelvic stuff kind of come up later?
She came to see us for both, but she started working with a functional medicine provider that we sent her to, and they are focused mostly on gut.
Yes.
Yeah.
But yes, there's absolutely a connection to that first part of the large intestine, the cecum. It's not in everybody. Not everybody has this, but there is a ligament that attaches directly from the cecum to the right ovary. It's called the ligament of Clayette.
Ooh.
Yeah. So
getting fancy.
Yes. But we treat that we find that pretty often. We find that that's oftentimes a point of restriction or of tension. Individuals that are complaining of that history with pelvic or women's health issues, and then also have maybe some of that digestion piece for sure. So very commonly we work on that, and it can free up a considerable amount of tension within the right pelvic region, basically. So then the ovary gets to move better, the large intestine gets to move better, but then I've even seen some relaxation into some of the pelvic floor muscles on the right side. So pretty profound.
Yeah. And I think with this specific patient, she was having all these cysts. She eventually got diagnosed with endometriosis through surgery. And when they went in, they kind of cleaned up a lot of scar tissue around her ovaries. And her main lingering issue is that area of the large intestine. And so we've kind of resolved a lot of the endo issues, a lot of the cyst issues. Sorry, not the cyst issues. The cyst keeps coming back because of that lower right area of her large intestine. She still has inflammation. So it's just, this introduction, this kind of case study is more just to show how intertwined our body is and how we can have this patient who presents with a women's health issue, but
Yeah.
there's so many different moving parts to it.
I think ultimately, yeah, like you're saying, that's what's incredible about even our listening technique, our evaluation technique, because common women's health issues are so much more than just what's happening in the uterus, what's happening in the ovaries.
Mm-hmm.
It's what's happening in the whole system.
Mm-hmm.
You have to take into account physiologically or function wise all the other organs that might be even involved in hormone regulation, or the areas of the brain
Mm-hmm.
involved in hormone regulation.
Mm-hmm.
And then even tension wise, mobility wise, what are all the other organs or structures or pieces of anatomy that the uterus or the ovaries come in contact with,
Mm-hmm.
and how is that impacting the overall function?
Mm-hmm.
And so we really do get to assess the whole body in that regard, which is pretty incredible.
Mm-hmm.
And that actually reminds me of another patient that we have that originally came in with primarily digestive issues, history of repeated head trauma, which
Mm-hmm.
we can always chat more about how head trauma impacts
Mm-hmm.
women's health issues for sure. There's a huge link there.
Yeah.
But primarily digestion, some of the head trauma. And I think even it took her to the second or third session for her to even communicate that she was having pelvic floor, pelvic issues. She's like, oh yeah, I also have extremely painful periods, extremely inconsistent periods, and a lot of pelvic floor pain. And I think my first 3 sessions with her,
it was pretty quick.
Yeah, we're primarily treating the liver and the pancreas. Right? I mean, she had mentioned that, and I was like, oh, maybe there's going to be some tension down here. And yeah, by all means, there's tension down in the pelvic region, but still the body was like, treat the liver and the pancreas, treat the liver and the pancreas. And I think around session 4 or 5, she started saying, oh yeah, my periods have been a lot less painful. They've been a lot more consistent, not getting as much pain into the pelvic region. And so again, it's pretty incredible. I mean, working the liver, I mean, hormonally, metabolically, the liver and how that impacts
huge
women's health, the ovaries, the uterus. I mean, it's pretty incredible.
Yeah. So it and I think that ties into a lot of times when anyone comes in with a women's health issue, we are trying to track their cycle day to see how organs are moving or not moving during different points in their cycle. And some of the main organs that we will check kind of outside of the listening is the pancreas. We will check the kidneys, uterus and ovaries, thyroid gland, so feeling if that's moving. And then we have the pineal gland, hypothalamus, and pituitary. So I'm sure the pancreas was just one of those big.
That was a big hitter for sure.
For her. Yeah. So, and when we're looking at that whole hormonal system, we're looking, are they sluggish, really? So less of a mobility standpoint and more of that motility with a T. And if like kind of picking like 2 or 3 that are off and balancing that motility to help with, if someone has a lot of stress or sleep issues, the pineal gland up in the brain. So I'm pointing up here, but the structures within the pineal gland, hypothalamus, and pituitary gland are all within the brain. And so being able to make sure that sleep is regulated, and also just the important hormone aspects that are addressed in there too. I think I missed the adrenal glands too. I said kidneys, but
yes, the adrenal
glands.
Gotta toss those in.
Do you want to dive into some of the head trauma stuff?
Yeah, it's pretty wild. This is actually something that I've been investigating a little bit more in recent time frame, but really incredible to see the impact that head trauma can have on the body at whole, but specifically in women or regarding women's health issues because of the pituitary gland, basically. So that posterior gland to the pituitary gland, the posterior aspect of it is ultimately, I mean, both the anterior and posterior part play a role in hormone regulation, but huge impact in terms of the control of certain hormones that impact how the uterus functions, how mammary tissue functions, so on and so forth. So we have actually looked into some patients that get changes in their periods and their menses following a head trauma, following a concussion, following a fall. And you have to, what we basically do is assess the integrity and the movement that exists within the, Missy's going to grab the head here, but that suture, that joint that lies between the cranium. So we usually refer to, we have the visceral cranium, which is, correct me if these words are wrong. Okay, visceral cranium, which is more of the cranial bones, right? That's around our brain. And then we have the facial cranium, right? Or no, visceral cranium.
We'll move on. We'll move on.
Anyway, so there's a suture that exists basically right where that pituitary gland lives.
Yep.
And so we can work
just
on
kind
tension.
Of right in here.
Exactly.
Right in here.
If you're watching us on video, you can see that it's actually this way, right?
Yes, I'm backwards on the camera.
Backwards.
Yes, there we go.
So it goes, basically, you can find the front of that suture right between the eyes, like right between your eyebrows, and then it transcends back towards the back of the head, basically, right? Towards that, underneath the ear almost. So huge surface area within that suture. A lot of tension exists and basically compounds at that region after a head trauma. And so because of that tension within the cranial bones, you're going to have an impact on the pituitary gland after that trauma.
Yeah.
And so then you start to notice, or you can find people that get the changes in menses in that type of incident. So again, we work to reduce that, to reduce the impact of that.
To offload pressure on that pituitary gland. And it's an area that if someone is pregnant, we will avoid working. That's how profound it can be. We don't want to rock the hormones in that state. But even there's this really cool video, if you're looking at the video right now, of like a soccer ball hitting a face, and you can see how mobile or how much tension can be pushed through the skull.
Yeah, definitely how mobile everything. I don't think anybody thinks about how we have a crap ton of joints that basically exist within our face and our skull, and all of those have some capability of movement. Yeah, the slow-mo guys. The video is all the slow-mo guys. So if anyone wants to see it, you can look at their YouTube. Oh, that's the name of the YouTube. Okay. And it's one of their later videos, and you see the soccer ball hit his side of the head, and all the shift that happens, and you can really appreciate the level of tension or how much that force really is transmitted through that craniofacial junction.
That suture.
Yeah, that suture.
Thank you, Betty, for participating.
Yes.
We should probably draw that line on her.
That would be
good. Okay, so when we look at some more specific pregnancy, fertility related things, a lot of times what we can see is, so the pelvic organs sitting in kind of our pelvic bowl is what we can call it, can be a vulnerable place because of a lot of just gravity pressure. It's kind of the bottom of the pressure system. But they're designed to be able to withstand that pressure. That's the beauty, is our body was designed to have these structures down in that space. But because of a lot of tension, maybe falls to the tailbone, longstanding digestive issues, constipation, and then just the position of the pelvis can add a lot of force and what's the word? Just altering the position of the uterus, fallopian tubes, ovaries, potentially making it a little bit more challenging to conceive. And so if we look at, one of the interesting ones is, a lot of people are familiar with having one leg longer than the other. And so if that's not a true leg that is longer, like a leg bone that's longer, if it's just positional from the pelvis being twisted, if that pelvis is twisted, the organs could be causing that twist, or they could be twisted because the pelvis is twisted.
Yeah.
And so if you look at when the egg is released from the ovary and drop down into the fallopian tube, if there is a twist in that fallopian tube, a kink in the hose, the egg is not going to make it into the uterus where it needs to be for conception. And so I think that blows my mind that we have the ability to kind of create space, even if it's another organ like the small intestine dropping down and compressing the fallopian tube, or taking the uterus and putting it in a retroverted position where it can't implant the ovary as well, or the egg.
Yeah, the ovum.
The ovum. There we go.
Yes.
So it's kind of a hard thing to talk about without visuals. I'm like,
I know.
I'm trying to be Italian right now.
Right. Talking with your hands. This travels here. This does this.
Yeah.
Yeah. That is pretty.
Yeah.
I mean, so impactful.
Mm-hmm.
And I think that you've seen the positive results of that with quite a few of your patients, right?
Yeah, and it's one of those things where we all get very excited to get that email, text message of like, hey, I'm 6 weeks pregnant, something like that. I think with this work, you can never just attribute it just to this, because these people who come in, the woman, their partner, they're doing so much. They're doing everything they can for IUI, IVF, or just natural pregnancy. And so it's hard to just attribute it to this, but we can feel the tension changing, and we just tell the patient, we're doing our best to optimize the function of your organs, and then we'll see what your amazing body does with it.
Is capable of. Yeah. Even just to take somewhat of or have some influence or some role in that is always really cool.
Yeah.
Even just through education, I think that's always powerful, because we always try to do that too.
Yes. Yeah. The education piece is huge. So yeah, and then when we look at helping women once they have conceived, throughout that pregnancy portion, we don't do like pelvic organ work, but there's areas that we can help with around ligament pain, low back pain, opening up some of the nerves around that area. Morning sickness is a huge one. Yeah. Being able to work stomach and even kind of the sphincters in that area, right?
Yeah, definitely.
So that's a lot of what we do during pregnancy. And then postpartum is huge. Yeah. So
that's where we really shine.
Yes. Because we have this fetus that was growing, and the organs are moving out of the way. And then they have this, the woman's body has this quick weight loss. Yeah. And one of the organs that actually responds mostly to that quick weight loss is the kidneys.
Yeah, definitely.
Yep. So they can, if they don't drop back where they belong, depending on the labor process, if there was forceps or a vacuum that had to be used to get the babe out, what other organs maybe came with that. Yep. And then looking at C-section. So if there's
huge.
Yes. Yeah. So if there's just so many different layers that they have to cut through and things that they have to move around. Yeah. And I loved learning about the minute an organ is exposed to the outside air, how it can get a stickiness to it. Yeah. And so being able to help the body move in those sticky areas again too.
Yeah, absolutely.
So we will see patient. We try to do a 6-week check-in postpartum, mostly because we find women oftentimes are told at 6 weeks that they're good to go and sent on their way. Yes. So if they did have a C-section, we will still do a 6-week check-in, but then we will also do 3 months more when like the tissues are healed. Yeah. But there's still tons of areas that we can work on in that.
Yeah, absolutely.
And you're postpartum the rest of your life.
Exactly. Yeah.
So it's never too late.
Exactly. Exactly. And yeah, I mean, one of my favorite things that I have experienced basically with working with postpartum women is, I mean, a lot of those women are coming in and they're like, I just want to feel like myself again, which a lot of times it is more of a reframing of, okay, yes, your body went through this. Maybe it won't be 100% of what it was before, but how can we get you back to feeling like you, right? Yeah. And so a lot of what we do really helps with that.
Yeah. Definitely giving that empowerment. It makes me think of a patient that I had a couple years ago. So we work with diastasis recti often. So that's the over stretching of the space between the 6-pack ab muscles, which is a normal process during pregnancy. Yep. but the problem comes when they don't come back together to be able to function as well. And this woman, her kiddos were 35, 35 and like 37, and she still had a diastasis that she was trying to navigate. And she had done so much exercise and other stuff, but she still had some tissue restrictions in her, if I remember correctly, it was small intestine, liver, and a little bit over the uterus. And within one session, her diastasis reduced by a finger width.
Wow.
Which is crazy. Yeah.
That's incredible.
Yeah. So just being able to see that quick of change in something that can be very frustrating for patients.
Absolutely.
Yeah.
So powerful.
Yes. Yes. Very powerful. So we think there's so many different things, but maybe what we can do is finish with one of the ones we haven't really talked about is like sexual dysfunction, sexual pain, that kind of thing.
Yeah.
Which it is, I would say it's pretty heartbreaking to hear how many women have pain with intercourse and have either never talked to someone about it or have just accepted.
Yep, that this is normal. That this is what a woman experiences.
Yeah.
Yeah.
I would say it's very heartbreaking. So I would say everything that we've already talked about can be related to that if we have tension on the actual pelvic organs, narrowing the vaginal canal or putting pressure on the cervix, stuff like that. Yeah. And even some of the stuff that you've talked about above and below the diaphragm, just balancing pressures can make even just different sexual positions a little bit more uncomfortable depending on how things are situated.
Yeah, absolutely.
So we can work a lot of the nerves in that area. So lumbar plexus,
sacral plexus.
Yes. And just decompressing the sacrum itself, right?
Yeah. Opens up so much. It's really incredible. Yeah, a lot of that lumbopelvic, lumbosacral dysfunction impacts those organs so incredibly much. But even something I think that I've seen is almost like the left versus right patterns, right? I mean, we pick up on a lot of those different patterns side to side, and it's very common for people to come and say, I have pain on one side of the pelvis versus the other, even related to like sexual dysfunction. Oh yeah, I get a lot of left-sided pelvic floor pain with penetration or whatever it is. And again, you have to consider, you have to evaluate the whole side, right?
Yeah.
And then that even can, I mean, we don't have to go into this now, right? But even some of the emotional implications of, okay, what is going on that left side? What's more linked to the left side? Things like that, or right, so on and so forth. But,
yeah. Makes you want to go down another rabbit hole.
Yeah,
but we
many
don't have
rabbit holes.
But just to clarify too, with the sacrum bone is basically, it's a triangular shaped bone that sits at the bottom of the spine and kind of builds the backside of the pelvis. And so a lot of the pelvic organs, uterus, ovaries, rectum, bladder, and then prostate, if you're male, sit in that space.
Yes.
And so that's why we spend a lot of time decompressing that bone. And I would even just add, even just someone who struggles to have an orgasm, being able to improve blood flow. Blood flow is such a huge piece of that. And we'll probably have a whole nother male podcast.
Yes.
But just making sure that blood flow can go to that area to be able to work properly.
Yeah.
It's so huge.
Bring nutrition to everything in there, right? I mean, give it all the life that it needs to live.
Yeah.
To do what it's got to do.
Yeah. So.
Yeah, pretty incredible.
Yeah. It's, I would say that's a pretty good introduction to start. Yeah. So I would say we always want you to send us questions if you have any specific women's health questions. We would love to we'll probably dive deeper into each one more specifically at some point. But hopefully the hope of this episode was to introduce the power of organ movement once again, every session.
Yes.
And why it's so important just for specifically women's health issues.
Yeah. And I think, I mean, just to even advocate on that side of things, or even what we've been touching on, like if you are struggling with any of the things that we've talked about today, it is not something that you should be living with. It is something that you need to seek out help and support for, because there is so much more to life than experiencing chronic pelvic pain or a lot of these issues. And there is hope for a lot of them. So please, like Missy said, reach out. Any questions, concerns, we're here.
Yep. All right. On that note,
that's it for today.
Betty says bye. We will see you next time.